Good morning, everyone. Good morning, everyone. We are starting our IC. This is on the fourth industrial revolution. All the technologies there, such as artificial intelligence, 3D printing, innovations in wet lab, smartphone photography, surgical simulators, the metaverse of virtual reality, and so on. So we have been doing this instruction course for the past all India past 5 years. So and in all India as well as the state conferences. Hope this updates you on the recent innovations in all these technologies, and I hope you can go back home and utilize some of these technologies in your ophthalmic practice. I will start with smartphone ophthalmic imaging. So I'm Dr. John Davis. Sure. Okay, so now we have the slides on screen. Um, I'm going to talk about smartphone ophthalmic imaging, anterior, posterior, gonioscopy, topography, and measurements. So let's just see. I have some financial disclosures. Right now, I don't have any paid imaging software, but I do have some software which I made, uploaded on the Play Store. Firstly, let's see why we should click photographs. It is for documentation. Even if you see and draw, it never comes exactly as you see. And the picture gives you objective documentation of whatever you have seen. It can be given for expert opinion or for teleophthalmology as well. It helps you to monitor progression and regression of lesions such as corneal ulcers, abrasions, and all these corneal and conjunctival lesions. Patients can be shown the photographs of their lesions, and this, I assure you, improves the doctor patient rapport. The patient's adherence to treatment is a very highly motivated by them seeing their disease on a photograph. If you just tell them, they are not always convinced. There can also be software which is used to measure the area of lesions. So why smartphone? Because the best camera is the one that is always with you. It doesn't matter that you have a high-end slit lamp imaging device in another room. It doesn't matter that you have the best fundus camera locked up in the other room. It doesn't matter that you have all the imaging devices if you're not using them. So the camera in your pocket, you can just take it, click, and finish. You don't have to waste any time. And of course, it is portable. You can do a quick review, editing, you can share it, you can back it up online, and obviously, it is affordable. You can do gonioscopy photographs such as this. If you see here, these are all images which are taken with gonioscopy images taken with a smartphone OnePlus 3T, several generations old. And you can see the optic disc, and you can see nerve fiber layer. You can take images of the anterior chamber angle. You can check for you can take videos of the Goldman applanation tonometry. You can see the ostium, you can see the PI. Everything is clearly visible if you use a good smartphone. And sorry, yeah, so you can see the PI, you can see the ostium, and you can document it. That is very important. And in cornea, if you use you can take so many images in diffuse illuminations and slit imaging. You can show the pigments on the back of the endothelium. Retro illumination gives you beautiful pictures. This is actually some pseudo exfoliation, but you can see also pigments on the back of endothelium. You can do fluorescent staining and document that. So suppose you have a patient with some corneal aberration, you take a photograph, give it to the patient themselves. They will definitely come back for a follow up, and they'll come back to you for everything also. There are so many adapters which you can use. This is a universal adapter. It's available on Amazon, and so I think it is available from 500 rupees to 800 rupees. Just it's a little bit difficult to set up, but once you get the hang of it, it gives beautiful pictures. You can also use customized 3D printed adapters such as these. You can use things like this. This is also available in the stalls in the conference. All these will give you very good pictures. We in Arvind Pondicherry, we used to record our surgeries from the observer scope like this using the adapter. This is Dr. Prashant Girish here, and we recorded surgeries like this. You can use several adapters for that. This is one of the adapters. Get it on Amazon or wherever. You can. I'll just show a video of how it is set up like this directly, and you can place it in front of the eyepiece. This video is available on YouTube. I'm not showing the full video due to lack of time. And there are several camera apps. I would suggest the regular camera app itself if you don't want to go for anything extra. But if you don't have a good camera app, you can use Camera FV5 or Open Camera. Make sure these are the settings. Keep the flash off for anterior segment photography. Make sure HDR is off, AI is off, portrait mode and beautification mode, all those please turn it off. Keep touch to focus on, because you need to focus on whatever object you want to photograph and then take. Metering mode, it's usually on touch, so don't have to worry about that unless you know where to look for it. Zoom in a little bit so that the circle of the slit lamp is not seen. You just need the picture, and make sure the light is comfortable. Room lights, turn it off, otherwise there'll be some reflections here. Not much, but there will be some. And you can even take vitreous knuckles in the anterior chamber. Make sure the exposure is adjusted depending on the brightness of the area you want to photograph. So here I wanted to photograph the vitreous knuckle. Then adjust the focus by using the touch to focus, adjust the white balance, the ISO, the shutter speed. So all these you have to adjust. uh, if you keep high shutter speed, it needs a brighter light, so you adjust it accordingly. So these are some slit images. So again, like I said, touch to focus on your area of interest, adjust the brightness so that your area of interest is at the correct brightness. Everything else is dark, doesn't matter for this picture. But if you want to see this also, you add an extra illumination from the side. Okay, that will show you the iris details here as well as the slit. You can see the Morgagnian sunken cataract here. And this is some pseudo exfoliation in the angle. This is a focal decimate membrane detachment with a misguided laser PI. And you can see this area is what you want to focus. You have all this glare and light here. You crop it later. Okay, if you cannot crop it while you're zooming in, crop it later. You edit your images, you get it much better. So here the focus is important. The focus is supposed to be on the cornea. That is why the cornea is in focus. The iris will go out of focus, doesn't matter. Focus on what you need. Here you can see some corneal nerves. Again, you have to do a wider slit for seeing that, and change the illumination angle as well as the brightness. And some lesions you can adjust the illumination to see it. So if you do it like this, you cannot see this posterior extension. This fishtail is seen here. So this is a traumatic cataract. This is an anterior subluxated cataract. This is specular reflection. And these are all images which you can take with your smartphone. So I want to just conclude by saying that these imaging options are available to you in your pocket. Please use them. These are taken from a 90D lens. This is also taken from a 90D lens. So all these are definitely available to you. You can take photographs of the Vice ring, videos of the Vice ring. I'll just finish with this. I hope you can get the rest of the videos on YouTube. Due to lack of time, I am finishing right now. Thank you.
I think while he's setting up, if
Yeah.
you have a couple of questions.
If you have any questions, you
I
can
had a
ask.
question actually. So, if you, I mean, a lot of the two main types of phones are either iPhones or Android. Any particular, type of phone that works better for slit lamps?
Right. So if you have access to a phone with a single camera, in iPhones, that is the SE series. So if you have an SE series, they are not very high powered. They are, you know, probably the older generation, you always have an SE1, SE2, SE3 going on side by side. But those single camera phones are ideal. But you can do with a multi camera phone as long as you find the main camera and adjust accordingly. Over to you, Dr. Prithvi. He's going to talk about 3D printing.
Thank you, John, sir, for this opportunity. I'll be talking about the magic of 3D printing in ophthalmology. So, what is 3D printing? So, basically, it is a technology where we can build something really physical, like a physical object with a digital file. So, you can design something in your laptop and then get it actually developed physically. You will get it as a physical object. So, what are the processes involved in this? So, one thing is the designing. So, using CAD software or a scanner, you can actually design a model which you want, and then that will be sent to the 3D printing machine, which will go for the slicing, and then it will start printing. So, printing happens into different methods, which I'll talk about. Then is a post printing process, and then the final product. So there are different materials in the market which you can get, with which you can 3D print. So one is a polylactic acid, the other one is ABS nylon. So most of the prototypes can be done in PLA or ABS, because PLA is a little brittle, so we can actually use ABS, but for prototyping it is good. So once you are done with the prototyping, if you want to get for the final product, you can make another thing with a stainless steel or a resin. So resin is a little foldable, so the flexible also. So these are different materials used. So there are two methods by which you can 3D print. So one is the extrusion material and the other one is sintering. So extrusion, it is like printing a 2D image. It's like a single sheet of paper. So when we keep a lot of paper together, it becomes thick, right? So that is the exactly the way that this is going to print. It will print in 2D, one on the other. So it will make the whole product. And sintering is such that we have the powder in whichever material required, and the laser will actually deliver a little bit of heat, which will not be so much that it will melt those powder, but at least just to join those together, join the powders together to get a proper model of the design which you want. So different materials can be used, like SLA for model for prototyping, FDM for prototyping, inkjet are used for bioprinting, SLS for metal instruments. So nowadays it's all there everywhere. In education, we are doing 3D printing in aircraft, construction, design, manufacturing, and medical. And 3D printing actually, the children are able to understand this much better, and they are able to even make new designs of their own in their early age, and because they become inventors in the future too. So nowadays, people are using 3D to design the architecture of buildings. And recently, we have seen 3D printing a house being constructed in India. Also, the aviation department has, the automobile department has 3D printing done in their engines, and even the food industry has started 3D printing these their food. Even and NASA is also planning to take 3D printers along with them to their space missions, so that they can print all these instruments right there in wherever they are. And in health sector, we can see 3D printing has come into dental, where they use these 3D printed dentatures. So while taking consideration of medically, so it was actually introduced in 1990 by Mankiewicz in University of California, but it didn't take much of a uh, and by 2013 is what the 3D printing started getting a little more popular. So going directly to 3D printing in ophthalmology, these are all the places where we are able to 3D print structures, and we have a article by Dr. John in KGO. So where all we have used this? We have used this to make smartphone adapters, and Dr. Ahmed Ataya, he is also a good friend of Dr. John's, who has actually made this. There are fundus photography devices, which can be 3D printed easily, and it would only cost you around 200 to 300 bucks to make this in the 3D printed laboratory. And we also have a foldable red cam which is done by Dr. John. So this basically folds into a box, so it is so easy to carry. You don't really have to carry the old big tube like structures nowadays. You just have to fold it and you can keep it in your pocket. You can just take it all around and take images of the fundus, and it's going to be available in the market soon. So he's doing the final prototype of this. So like you can see, these are the images taken by that. These are the images taken from the John Das fundoscope. And we have 3D printed slit lamp microscope, which actually increases the zoom. Also, we have wet lab surgical models which are being used. We have so these are all used for training, and there are 3D printed models for planning radiations, even 3D printed model of OCT, which has been 3D printed to make the patient understand what he is going through in real time model. And also instruments are being developed for with the same 3D printing. And pupil expander link like Canabrava also used 3D printing technology to print his pupil dilator, and a lot of other things present in 3D printing for us. But I would like see there are also spectacles and lenses being developed by 3D printing. But want of time, I'm just skipping through it. So basically, we can the best part of this is we can actually start 3D printing ourselves by using a website called the Tinkercad. So these are all the 3D printed objects, and here is a website where we can actually 3D print by ourselves. You just have to go to Tinkercad, and you can see there there is a small tutorial also, and it is very simple, very easy. Even kids are doing their projects over here. So Tinkercad allows you to uh, use their software real time in the website itself online. You can design your whatever you want to, and then get the file and get it printed from a 3D printed shop. It is available. It's like a normal Xerox shop we have 3D printing shop as well. You just have to give them the file and they will 3D print the whole. So easy. You can do it with your laptop also. uh, and this is one thing which I want to stress, and learning this skill will actually help us think about new things, innovate and invent new things. And there is another website, Thingiverse, where you actually get a lot of these 3D printed printing model design already present there, which you can download and just give it to the 3D printing vendor who will actually deliver you the objects. So you can see over here, these are all the uh, documents that you get. You can just download it. Even there are a lot of models for medical ophthalmology, medical also, like the skull. And also you can see there are things for ophthalmology like the lens guard for breath guard. There are vernier calipers, occluders, 90D to 78D protecting boxes, etc. So these are my innovations on 3D. This is the slit scope which I have designed. It's just with the torch, just 350 rupees. And the best part is with the ASP, which is a magnifying device, we are able to take these kind of images and videos without a slit lamp. There is no slit lamp involved in this, and it gives exactly the quality of image that you take in slit lamp. Also, this is the gimbal scope. Basically, this is the one we use to record. This is the first time we are actually presenting in All India also. A very novel way of recording retinoscopy reflexes, which were not been possible before. This is the adapter which we have 3D printed, and this is the reflexes which we could see with the 3D printed adapter. So these kind of things were not done before, but now we are able to do this because of 3D printer and the designing. So neutralization, and you can see how beautifully you can see the scissor reflex too. Thank you.
Thank you, Prithvi. I think it was a wonderful session. Any questions? Thank you. Next, I call on Dr. Meeta Joshi to talk on smart apps for ophthalmologists.
Good morning, everyone. Thank you, AIOS and Dr. John, for this opportunity. Apps, as we all know, are a self designed program or piece of software to fulfill a particular purpose. And now you have apps which vary in function and content and are now a part of our daily life. Apps in ophthalmology include apps for medical education, practice management, journals, conferences, patient utilization, and imaging, which we have already seen. Medical education, you have lots of apps. One of the most important one is the I handbook, which has a lot of features which allow us working in day-to-day life. And you have diagrams, consent, patient education, and testing. So you have the Amsler grid, color vision, contrast sensitivity, duochrome test, fluorescent light there. Contrast sensitivity helps you in emergency room or bedside examination. And usually we don't have any charts with us handy for this, so we can use this for the contrast sensitivity testing. Worth 4 dot test, you always do the distant one on a vision chart, but for the near one, you can use this. The color vision, we all have our little black book, but sometimes the prints fade with time, and so you can use this to test your patients. There are pediatric optotypes and fixation charts. So, and we all know that kids love the devices, so you can use this. You have the laser settings at your fingertips, so you can just have a ready retina kind of thing. You have calculators like the bifocal add, amplitude accommodation, radius conversion, IOL calculators, and your SIA calculators, which directly connect to the online calculators. There are diagrams in the app so that you can explain to your patients like diplopia, glaucoma, and other symptoms which the patient would have. Ophthalmology app allows you to have disorders of the eye at your fingertips, so you can just quickly tick whichever you want and have a brief synopsis of the disorder. Draw MD allows you to explain medical conditions to the patient. So you can just sketch and do it, and you can have the patient's image on it and share the image with the patient. iTube allows you to have a variety of videos, surgical and otherwise. The glaucoma risk calculators is a useful app which allows you to consider the treatment and other guidelines for the patient. So you can just enter in the parameters and it will give you a guideline whether to treat or whether to just observe the patient. Park's step test. This was always been a nightmare. Which eye, which muscle, what to do. So this allows you to just evaluate your patient. TLA ophthalmology. It tells you all the short terms, short forms, acronyms which are used in ophthalmology. So it is a very useful guide. Embryo is for your patients. You can just give it to your embryopic patients and ask them to do these exercises at home. And since kids are very fond of using the smartphones, they can always be relied upon to do this exercise very meticulously. You can have Snellen chart on your phone, but then you have to have adequate illumination and other settings in your phone also. There are the toric calculators, LRI calculators, surgery simulators available. You have practice management apps like the Dropbox, where you can share your documents, sheets. You have various scanners like the cam scanner or the doc scanner, which allow you to scan your documents, and you can just have them for your pursual later on. You can have your OCT browser on your iPhone, Telepax, Cam card, which allows you to scan your visiting cards into the phone book. Hippocrates allows you to have your medicine dosages because we tend to forget the systemic dose of medications. And Skyscape also allows you to manage your documentations. You have apps for medical journals. We have our own IJO on this now. You have the Will's Eye Manual, Atlas of Ophthalmology. Apps related to conferences are now a routine, so that allow you to plan your day, just see what is going on in which hall, and then you can just follow accordingly. For patient utilizations, you can have the patient download the app into their own smartphone and then use it and monitor it. So you have the side book, which allows them to do an AMSLR and just see progression or whatever and come back to you when they have any problem. Then you have tests which allow the patient to check their astigmatism, but this then has to be reinforced and retested again. You have the AMSLR grid on the phone so that the patient, your retina patients, can do a weekly monitoring and come to you whenever they find a problem. This one, Dr. Hugh, is for contrast sensitivity testing. It is a game, but then your patient can always check his or her level and report back to you. Eye drops is a very useful app. The patients are usually senior citizens living alone or just the two of them, husband and wife, with no other support. So you can always add this into their phones. So it serves as a reminder to put in the drops at the proper time. Be My Eyes is for low vision patients. It actually is an online this thing. So the patient would send out a call, and if somebody is there around, they would help that person. So they just scan their surrounding, and the person who's come online to help them would tell them what's going on around them. You have fancy this thing contact lenses, and also you have an avatar and just check whether the lenses are suitable on your face or not. This is one important thing which is now very close to my heart because I have a cousin who's lost his sight due to diabetic retinopathy, and he helped me search for apps and other modifications which help him in his day-to-day life and do his work also. So these are accessibility tools for the various impairments like visual or hearing or learning or cognitive. And there are guidelines, web content accessibility guidelines, which have some certain principles like whether the system accessibility tool which has been designed is perceivable, operable, understandable, and robust or not. So you have various screen reader softwares, speech recognition softwares, special keyboards are available, and you have screen magnification devices. These are just a few videos which I've taken with my cousin. So you have this app which allows you to locate things. So the moment a person enters the room, he can just use a smartphone, scan around things, and find out where he's entering, whether there are just one or two people in the room or the room is crowded or whatever is going on around, he can know. Can I have the audio on this?
Mode, 3 of 6. Text, selected. Double tap to select. Lookout text mode. Retinal diseases, 3rd edition, JSPAHWA, OPBILLORE.
So similarly, it allows you to read the whole book by taking the images. You can have it on your Kindle, and that will allow you to read also.
Captures a photo and describes the scene in front of you. Double tap to activate. Describe scene. Captures a photo and
So
describes
you
the
can
scene in
take
front of you.
pictures, it will
Selected.
scan and tell you what is in your surroundings. This allows you to read from your Kindle itself. You
किताब
can,
बदलने की जरूरत है, बड़ा पोता लगा लियो चल तेरे से चल से 4 5
right? So you can design your own app so that your patients can be in touch with you, fix appointments, give a feedback. There are issues of patient privacy, sharing information, and confidentiality. Germ carriers, they have been, cell phones are notorious for being that. How much content you can share over the social media, the app which is there, is it authenticated, validated, and whether it has an approval or not. These all are issues which we are dealing as they crop up. Thank you very much for this opportunity.
Thank you, Dr. Mita. Anybody has anything to comment or any questions which we can answer?
Our next speaker is a very interesting and dynamic Dr. Akshay, and he's going to talk today on the surgical simulators, how they are changing and training landscape. Thank you, Mita Joshi. It was a wonderful session with new innovations of apps.
Okay. Okay, it's cropped. Okay, perfect. So, how simulators are changing the surgical training landscape? Simulators have been around in training for a long time, especially when it comes to flight simulation and learn for pilots to train. It's been around for medicine and surgical training for quite a bit, about nearly a decade and a half. But the level of realism that the simulators are demonstrating of late has really changed how people can train. So, what I'm going to talk about is the types of simulation in ophthalmic training, the types of simulators, and how do we assess the performance of a trainee on a simulator, and what does literature really tell us? Does simulation really help in improving the training and the outcomes? So, simulators are available for everything, for clinical skills, for examination techniques like ophthalmoscopy, gonioscopy, for clinical procedures like lasers, surgeries, mainly cataract, vitreoretinal, and a few other procedures as well. So, when we talk about non surgical simulators, these are some of the non surgical simulators. There's the indirect ophthalmic simulator, where you can learn how to visualize the entire fundus or the aura through 90D or 20D. You have the ret eye and the simuli, which are eyeballs with a fundus recreated within, in which you can use lasers to practice on how to aim, focus your beam. Then, of course, we know about animal and human cadaver models. Uh, so basically, these are devices for training that are being created to imitate a similar situation that we would encounter in the operating room. So we typically hear the words wet lab and dry lab. So what exactly is a wet lab? And so basically, whenever any simulated device or a setting is used where chemicals or tissue that can be wet hazards like human eyes, artificial eyes, animal eyes, these are all wet lab components, or they can be mixed of even vegetables and fruits, like we've seen recently, during COVID, where a lot of new innovations were coming out. This is a picture of how a goat's eye is microwaved for about 40 seconds, and then you can perform phaco on it because the cataract has been induced. You have artificial models which are inanimate, which are created to resemble the human eye, like an artificial chamber. This is the Kitaro wet eye set, where you can go in and inject viscoelastic, recreate a viscofilled anterior chamber, and they have a small cellophane tape like anterior capsule which can be used to practice capsulorhexis. But the thing is, each attempt utilizes an eye, and there is a lot of cost to each surgical attempt or practice attempt that you make. There are other things like this gel filled Phillips eye, which can be used for vitrectomy. People have even tried to use a thin, stretched out aluminum foil as a simulation device for capsulorhexis. But the point at the end of the day is, how do we know whether it works or not? And you can learn to do capsular access in a Kitaro eye or an animal eye, but does that really translate to skill in the operating room? So that's when we come to assessing skills on a simulator. And the only simulators or only simulation devices that allow us to assess skills are virtual reality based simulators, and they can be either cognitive or technical skill. So we know there's an ICO Oscar. The Oscar stands for Ophthalmic Surgical Competency Assessment Rubric, such that basically anybody and everybody who assesses a surgery can follow the kind of rubrics that are there here and give a grading, so that it brings in a level of objectivity. It's there for phaco, it's there for small incision cataract surgery, and now it's also there for performance of surgery on a simulator, and it's called Sim Oscar. So that there is a standardized rubric on which you can assess how a trainee is performing surgery on a simulator. And they have been used, they have been validated, and using the performance and assessing performance on the simulator, they've actually seen that simulators have improved surgical performance of small incision cataract surgery in sub-Saharan Africa. This is a screenshot from the IC VR Magic simulator, where it allows you to perform tasks, and as you increase your tasks in complexity, only when you reach a score of 100 does it allow you to go on to the next task. So thereby, only an increased competency allows you to progress in tasks. Now, this is the Help Me See Eye Surgery simulator. Now, you can see that on the left, the surgeon is performing let me just play the video. Is it playing? Yeah. They're doing trying to deliver the nucleus. And while they're doing a delivery of the nucleus, there are errors like zonular damage which are showing up. At the same time, the simulator is also capturing all these details of whether there's an endothelial touch, a contact with the iris. So the simulator itself is able to grade your performance and tell you whether it was satisfactory or not. And the advantage of these simulators is that there's no worry of collateral damage, because you're not harming the patient. Now, if you were to do the same thing on a real patient, the patient may end up with suboptimal vision. But here, you can do multiple attempts, you can learn, unlearn, relearn. And the advantage of this is that the visuals, the graphics, and the realism, along with the haptic feedback, which means that the Help Me See Eye Surgery simulator here, when you touch the virtual eye, your instruments actually give you the sensation of touching a human eye. So the spatial realism is also extremely high. But at the end of the day, we've assessed these performance on the simulator. We've trained people on the simulator. How do we know that it's going to help them in the operating room? Well, there's actually enough evidence to show that it actually does. This is a paper from 2013 where they had trainees perform capsular access on the simulator and then go back into real life surgery. And they compared the two groups, people who learned on the simulator and those who didn't. The simulated group did better. Simulation training reduces intraoperative cataract surgery among complications, so much so that in the UK, all surgical residents in ophthalmology have to mandatorily undergo 60 hours of simulation based training in order to get their surgical practice license. Again, a paper from Sweden, where cataract surgeons were who senior cataract surgeons, when they performed on the simulator, had a better performance than medical students or untrained people. Again, IC surgical simulator improves performance for capsular tension ring. And this was a paper that I published along with our colleagues at Help Me See, where we had two groups of trainees, one who learned SICS on a simulator and the other who learned it as per their regular wet lab training. They went into live surgery. The first 20 surgeries of each trainee in both groups were assessed, and all the videos were then seen by masked observers who graded them based on technique, outcome, and the number of errors. Now, the orange bar that you see is the errors of the control group, the group that learned surgery through wet labs. The blue bar is those errors by trainees who learned on simulation. Now you can see there's a 50% reduction in the number of errors, major errors, minor errors, and in total all errors. So to summarize, the variety of simulators that we have is truly changing the landscape of training, because it allows a stress-free environment where a trainee can do an error without any fear of repercussions. There is no collateral damage. At the end of the day, we are improving performance, improving confidence, and improving patient safety, because at the end of the day, our doctors, that is the sole paramount responsibility that we have. So while training, if we are able to improve outcomes, I think we're doing a great job. For those who want to experience the Help Me See Eye Surgery Simulator, it is available here at the Help Me See booth at 123B. Thank you so much for your time.
Thank you, Akshay. That was a very interesting, innovative topic. And any questions? Thank you. Now I call on Dr. Devika Bhattacharya to talk on artificial intelligence and machine learning in ophthalmology.
Hello, am I audible? Am I audible? Hello, good morning everyone. Thank you AIOS and Dr. Johnson to give me this opportunity. I will be speaking on machine learning and artificial intelligence in ophthalmology. There are no financial disclosures. First of all, I would like to say that artificial intelligence is the ability of the computer system to perform tasks that require human intelligence, such as visual perception, speech recognition, decision making, and natural language processing. AI is achieved through the use of algorithms and statistical models that allow machines to learn from data and make precise decisions or decisions based on that learning. In real life, we have the examples of ChatGPT, Alexa, Google Assistants, and so on. Machine learning is the main source for artificial intelligence. Coming to subsets of artificial intelligence, there are 10 subsets, out of which machine learning, deep learning, expert logic system, a fuzzy logic system, and neuronal networks are our main concern. These are the subsets of this is a flow chart depicting artificial intelligence and their connection between the different arms or subdivisions. Use of AI in ophthalmology. There have been several case studies and clinical trials that support the use of AI in ophthalmology. There is a study which is published in JAMA in Ophthalmology in 2018, which shows that AI uses deep learning algorithms to analyze retinal images, identify signs of diseases, which are much more accurate in comparison to human ophthalmologists. Again, a study published in Translation Visual Science and Technology clearly shows that it is based on OCT images of the optic nerve head, which uses deep algorithm to analyze images to identify the features associated with glaucoma. So additionally, few more studies which shows the use of convolutional neuronal network to analyze images and identify signs of disease, which by using OCT images. It also helps in cataract surgery planning, which by using machine learning algorithms to analyze preoperative measurements so that we could identify the risk factors that could affect the outcome of surgery. These are various machine learning systems. Coming to the first subset of AI, that is machine learning system, we have monitoring tools in that, screening tools, diagnostics tools, such as Opticane, Retival device, iArt system, IDXDR. iArt system is FDA cleared screening tool for diabetic retinopathy. Then we have Retival device, which helps in diagnosing various retinal disorders, and IDXDR, which is also approved for diabetic retinopathy. Coming to second subset, that is expert system, it helps in cataract surgery planning and glaucoma diagnosis. There is a cataract coach which uses biometric data and patient information to determine the optimum intraocular lens power and the surgical plan. Another cloud-based solution used for help in glaucoma diagnosis. It analyzes data from visual field test and OCT scans and identifies the probability of glaucoma. Then we have refractive surgeries and retinopathy diagnosis. There is a software program known as ART-SCAN, which uses data from corneal topography and patient information to determine the optimal surgical plan and is used for refractive surgery planning, such as LASIK. We have Retinoscope, which helps in the diagnosis of retinopathy, which analyzes data from the OCT images and the fundus photographs of the patient. Another subset is the fuzzy logic system based. There is Optimize, iQuant fuzzy logic system based glaucoma diagnosis and fuzzy logic based cataract grading system. This Optimize is a website which helps it simulates the effect of different types of intraocular lenses on the visual acuity. iQuant is a web page tool which helps the web designer to analyze the visual impact of web page designs. Then we have an app which acts on both iOS and Android devices, which helps for diagnosis of glaucoma by the use of clinical and imaging data. Then we have fuzzy losing system based cataract grading. It is also an app which helps to grade cataract based on combination of clinical data, including visual acuity, glare testing, and slit lamp examinations. Then we have the deep learning systems. We have eye wellness exam, which analyzes OCT images, scans for the retina, and diagnoses ARMD and DR system. Then we have WIS AI, which analyzes CT scans in real time to detect the brain stroke and prioritize large vessel occlusion strokes. We have Notal Vision Home OCT, which allows patient to perform OCT scans at home for the detection of disease progression with patients of ARMD. We have DI and Topcon Harmony, which have various products for the use of which use the retinal images to detect signs of diabetic retinopathy. Use Now coming to individual subspecialties, we have use of AI in retinal diseases, which has INUC, IDXDR, Remedio Fundus on phone, and Retinalize and Retinal AI, which is an app. iNuke is a website which you can take iNuke. This is FDA cleared and CE mark. This IDXDR is also retina based device which is also FDA approved, and there are various studies which shows the use and which shows the validation of the device. IDXDR is a software program that uses this uses Topcon Harmony and uses artificial intelligence to analyze retinal images. This is IDXDR image, which shows vision threatening diabetic retinopathy. This is a fluid intelligence AI app, and this is Remedies Fundus on phone. Various websites which are powered, I will just enumerate which are website powered for AI. This is Google AI Healthcare, Topcon Healthcare, Nova Site, and Notal Vision. These are the platforms used for vision testing. This is IQ, Peak Acuity, Colorblind Contrast. I will just enumerate the cornea devices which are used for cornea. This is Caranova, Cornea Need Pro Scanner, Quick, YBX Rapid, iNetra, Media Integrated Imaging Service, Topcon Harmony, and Remedio Anti-Imaging Module. Uses of AI in glaucoma, we have Deep Glaucoma Net, Eye Wellness Exam, Quicker, Similar, Simpler, Safer, and Glaucoma Finder. These are all web page and software applications, and IR AI. Then we have iNetra. This is also validated. These are various studies used for the clinical evidence and validation of this device. Now, various algorithms which is used to calculate IOL power, I will just name it and you can take a note of this website. There is Reiner IOL calculator, IOL Master 700 online calculator, Barrett's Universal 2 Formula AI to estimate the effective lens position based on the eyes preoperative biometric data. Then we have IOL Master 700 online, iSuite IOL website, Surgery Map 3D stimulator. These are the IOL. Again, we have Orasis AI, ERUO, IOL Master 700 with Swift source, and cataract surgery calculator. These are all web-based tools. These are all website used for Alcon Acrisoft toric IOL calculator and Bosch and Lomb Tugrin toric IOL calculator. These are the pictures which helps. It is present in ACRS website. Lastly, we have rbfcalculator.com. This is also a website to calculate IOL. Now, coming to the conclusion, there are benefits of AI that can help in automation, efficacy, personalization, improve decision making, improve patient outcome, and better health outcomes. There are major concerns for AI are bias, job displacement, privacy, security concerns, technical challenges, and future. Coming to the future, it will help in early detection, personalized treatment plan, predictive analysis, and telemedicine. It can also be used It can also be integrated into a telemedicine platform to provide remote screening, diagnosis, and treatment of eyes. So, ophthalmologists should know about the AI resources available to them and make judicious use of them when understanding their limitations. Thank you.
Thank you, Devika, for your talk. We'll have Dr. Prashant on his innovations in wet lab.
Good morning. I thank Dr. John for giving me this opportunity and the AIOS. Uh, Innovations in wet lab training. I think Dr. Akshay has also talked about all the simulations. I will also brief up. Introduction. Cataract surgery is specific and requires extreme precision. Um, it's advanced hand coordination and fine motor skills. Wet lab training, we can do it in three different ways, like animal eyes, eye models, virtual reality. There is also an extremely cost time for the teaching of cataract surgery. So this was an innovation done in 2015, where the goat's eye was used for utilization in the cataract surgery. Here you can see a 2.8 millimeter incision. A capsular rhexis is being done, and initially the cortex of the goat's nucleus has been aspirated by the phaco, and then the wound incision is extended to 5 to millimeters to 6, and then a human nucleus is inserted. The wound is then sutured, and phacomulsification is practiced. So this will give a real-time experience of nucleus trenching, and so that gives a very good control and thing. And this was another innovation by the team, which has done the safe device, which is called the spring action apparatus for fixation of the eyeball. So here it is an aluminum based. It's an aluminum based device, which is, you can see the tunnel shaped device is there, and they have kept syringe with a spring action. So this helps to create a vacuum in the tunnel, and that way it will help to hold the globe, and very strong. So you can see how they are practicing the small incision, and there is no movement of the globe. It is very sturdy, and it is used to practice a lot of techniques, and the IOP is raised around 17 to 19. And this Kitaro, I think Dr. Akshay has already spoken. The Bionico is a 3D printed eye model, which is actually made of a polyacrylate material. It was first designed in way back in 2018 at the Buskin Palmer University. It has various models. It's very flexible, and you can see here. I'll show you the video. So these are the 3D printed scleral rings, cornea, the orbital models. Soaked for 5 minutes. And then you can see the interrupted sutures practicing for the corneal suturing. And then these sutures are taken photograph under the cameras, and the assessment is done for the incisions, the length, the radiality. The cost of the 3D printing is very high for these models, Bionico. So I designed a model, a 3D printed eye model, which is made of an acrylic material, an ABS material, and we got a corneal mold, which is done with acrylic. So you can see the acrylic mold of the cornea, and a 3D printed base model with ABS, which is used to practicing for the phaco. Then this is a very interesting model. As we know that as surgeons, as you're practicing, the high hand positions are very important. This was an article published by Ahmed. The use of a microscope mounted wide angle point of a view camera to record the optimal hand positions in ocular surgery. So we also tried this connecting with the GoPro camera, and is very useful in the wet labs to practice the hand positions, which will help for better surgical techniques. So the microscope one is connected beneath the microscope, which will record your hand positionings. Eyesight surgical stimulation, it's innovation. I think we have already discussed here. The surgical stimulation helps to detect the patterns, your cognitive skills, and gives a real-time simulation of the surgery. And this is a video showing how the skills are being developed, and various activity levels are there in ISIM. Many of the institutions are currently using this. This is a video showing the capsulorhexis. You can also have options of choosing instruments, setting up tasks for every surgical. This is a divide and conquer. And a very good foot control practice is also being done. Studies have been published comparing the goat's eye models and the simulations, and of course they have found that the room effective in the wet lab and the time to pass simulators curriculum was predictive to the time of the overall performance in the operating room. This was the Help Me See. I was lucky to get see the demo versions in the New York, and Dr. Akshay has already discussed about the Help Me See simulators. This is the leap motion technology which we are trying to make, which is using a virtual reality device where creating stimulations of the phaco probe and the other devices and having a virtual simulation to understand more about the techniques, difficulty situations, and understanding more of other complex case managements. The advantages of virtual reality are a cost efficient and it's a maximal skill transfer is being done. It also helps in reducing the learning stress, increase surgeons' confidence, and also increase the residents' recruitment. So, video-based skill learning is very important. Always the discussions of the video post-surgical to understand about the steps, where exactly you're going wrong. So, recording video is very important. Uh, and telemedicine in wet lab training, real-time assisting and discussions of the surgeries by mentors. Thank you. And I leave the quote by telling, tell me and I'll forget, show me and I may remember, involve me and I'll understand. Thank you.
Thank you, Dr. Prashant. If there is any comments or doubts, we have 2 more minutes.
I don't think we have any more questions, so we'll hand over the hall on time to the next speakers. Thank you.